The Alliance for Eating Disorders Awareness is a national nonprofit organization dedicated to providing programs and services for people experiencing all eating disorders as well as their families. For 19 years, we've been working here in West Palm Beach to make sure that not one more life is lost to this insidious disease.
Eating disorders are often a maladaptive coping mechanism for an underlying issue of trauma. And much of that trauma can stem from gender-based violence. Unfortunately, there is an extraordinary high amount of those living with eating disorders who are also survivors of trauma, much higher numbers than in the general population, the eating disorder and trauma piece together. And so it is really important that those individuals who are living with the trauma from gender-based violence and an eating disorder get specialized care that they need from our first-line providers, doctors, dentists, nurses, who understand the trauma piece based upon their gender violence as well as their eating disorder. So it is particularly sensitive that we have to train providers to understand those issues when it comes to eating disorders.
So 1 in 3 individuals that develop an eating disorder have survived sexual abuse. Also, 90% of individuals that develop binge eating disorder, specifically women, have experienced some type of traumatic stressor, one of those being gender-based violence. When we're training providers, we also want to make sure that their approach to treating each individual is one of inclusivity and intersectionality. So we really want to make sure that they are really getting to know their clients and getting to know their background, where they're coming from, how they identify in multiple ways. With this funding over the next 2 years, we will be educating providers on how to recognize and refer when working with eating disorder clients.
During the trainings that this grant will help the Alliance provide, we will be conducting pre and post tests to gauge the healthcare provider's knowledge of eating disorders and gender-based violence before the presentations and after the presentations to make sure that they're learning pertinent information. We'll also be gauging how many of them plan to use this information in their practice, plan to use the screening tools that we'll be providing them with, and how many of them plan to keep on top of the latest research and keep on top of keep relationships with the Alliance so we can help them refer their patients for appropriate levels of care.